Hello and welcome. I'm Dr. Amin Gasmi from France, physiologist and micronutrition scientist. Today, I'm setting the stage for this series of videos on micronutrition, functional medicine, and also nutrigenetics. You will hear here a simple message. Complex symptoms come always from networks, physiological networks, not from a single organ. And micronutrition gives those networks the cofactors and the bioactive signals they need to function well, while functional medicine will map the systems, will set priorities, and also measure changes. Nutrigenetics will manage individual variability. Five main layers are to consider in any intervention. So we have inflammation and immune system, mitochondria and energy and redox, endocrine and metabolic signaling, gut and oral microbiome and barriers, and finally autonomous nervous system in relation with circadian rhythms. First of all, we have to stabilize priorities like gut and oral issues, fatigue, cravings, and sleep. Then we need to set a short detoxification and clearance. Then we have to implement nutrition patterns. Only after that, we could layer targeted micronutrients and finally a structured physical activity program. During this process, it's very important to track symptoms such as sleep, energy, body composition, and also heart rate variability, and do some selected lab tests. In this series of videos, we will focus on 6 topics: thyroid, vitamin D, nutrients, statins in relation with coenzyme Q10, LDL cholesterol and metabolic risk, intestinal hyperpermeability also in relation with autoimmunity, and finally, estrogen metabolites. Use these videos as educational tools and not use them directly. Try always to individualize interventions for the patient. Thank you for your time. I'm Dr. Amin Gasmi, and I look forward for continuing this conversation on micronutrition and functional medicine.